Now let us solve an MCQ on interpretation of tuning fork test. A middle-aged woman presented with right-sided hearing loss. So, which is the poorer ear here? Right side is a poorer ear. So when I say that left side is normal, that means left side is the better ear. See, this terminology is very important to understand or interpret Weber's test. First point is over. Second line is Rinnes test shows a positive result on the left side and Rinnes test is negative on the right side. So how do you interpret Rinnes test? When I say Rinnes test is normal. That means positive result, air conduction is more than bone conduction, is seen in normal ear or an ear with sensory neuronal hearing loss. Okay. So in this scenario, when I say Rinnes test positive, you can interpret it as a normal ear or a sensory neuronal hearing loss. When I say Rinnes test negative, that means bone conduction is more than air conduction. Where do you see this? Rinnes test is negative in case of conductive deafness. Because this is a poorer ear, okay, because this is a better ear, I am taking out SNHL from this. So here in this case, left ear is normal because in the question they are clearly given that the patient has a right-sided hearing loss. And on the right side, you have Rinnes test negative. That means the patient might be having right-sided conductive deafness. So this is what is your interpretation just based on the Rinnes test. But never ever only do Rinnes test and come to a conclusion. That is the main reason why we do Rinnes followed by Weber's to support our diagnosis. So let's see how Weber's test is interpreted. So usually in Weber's test, if tuning fork is placed on the vertex of the skull, the sound transmits. So we are only testing bone conduction here equally on both sides. So in a normal ear, if a person with both normal ears, Weber's, there is no lateralization. But here, what they have given in the question, when they did Weber's test, the Weber's test has showed that there is lateralization to the left side. There is lateralization to the left side. So left side, there is a lateralization. Let me give you the interpretation of Weber's test. Weber's lateralized to better ear. Weber's lateralized to poor ear. There are two scenarios for the interpretation. Third scenario is normal. Normal is done. Now we are only looking at Weber's lateralized to better ear, Weber's lateralized to poorer ear. From the question, which is the poorer ear? Right side is the poorer ear. Better ear is the left side. From the question, they have already given an information that Weber's test showed lateralization to the left side. That means lateralization to the better ear. Weber lateralization to the better ear indicates. So what does it indicate? Lateralization to the better ear indicates sensory neuronal hearing loss. Okay. So Weber's lateralization to the better ear indicates sensory neuronal hearing loss. Let me just simplify what is our diagnosis. So what is the diagnosis based on the tuning fork test here? Diagnosis 1 from the Rinnes test is right-sided. What is this? Right-sided conductive hearing loss, right? And what is your interpretation from Weber's test? What is the interpretation? Weber's lateralized to better ear. That means it says left-sided. What is this? Left-sided sensory neuronal hearing loss. So there is a clear mismatch. What is that? There is a clear mismatch between the findings from Rinnes test and findings from Weber test. Okay, actually this shouldn't be left-sided sensory neuronal hearing loss, right? Because left side we have normal hearing as per the clinical history. So there is a mismatch, and this is a typical scenario of, very important, false negative Rinnes. And this question is primarily based on the concept of false negative Rinnes test. So this Rinnes test negative is actually false negative Rinnes test, and this false negative Rinnes test is seen in very severe sensory neuronal hearing loss. So because the patient is having very severe right-sided sensory neuronal hearing loss, there is discrepancy in the tuning fork test results. Let me make it simple and clear for you. Here RT is negative on the right side, but if RT is negative on the right side, the Weber should have been lateralized to the what we call poorer ear, but instead it is getting lateralized to the better ear. So there is a discrepancy. Why this discrepancy is happening? There is a important key term, that is transcranial, just focus here, transcranial transmission of sounds, which is happening to normal ear. So when I do a Weber's test, because there is a sensory neuronal, very severe sensory neuronal hearing loss here, the sound is getting transmitted to the normal ear, and this is giving us what we call a false negative test, because when it is very severe, bone conduction is more than air conduction, giving a Rinnes negative test. So what is the answer for this question? The answer is option 4, that is right-sided sensory neuronal deafness. Let us also quickly look into the interpretation of tuning fork test. We are already done with this. Rinnes normal, that means air conduction through the air is more than conduction through the bone. Bone conduction only measures cochlear function, but air conduction measures both conductive mechanism and also the cochlear, that is sensory neuronal, and also what we call the conductive mechanism. So that's the reason in a normal patient, conductive H plus SNHL, that means air conduction is always more than bone conduction. The same thing applies to sensory neuronal deafness, because in sensory neuronal deafness also, because this bone conduction part is low, AC is always more than BC. But conductive deafness, the conductive apparatus is gone. So that's the reason the bone conduction is more than air conduction in case of conductive deafness, because there is a masking effect. Nothing is getting disturbed from the conductive mechanism. You can happily hear bone conduction in case of conductive deafness. So let me make it clear for you. Rinnes normal in case of, that is positive in case of normal patients, and also SNHL. Rinnes negative in case of bone conduction more than air conduction, and very important, Rinnes false negative in case of very severe sensory neuronal hearing loss. What is that? Very severe, because of the transcranial transmission of sound to the normal ear. Weber's, yes, no lateralization in case of normal ear, lateralized to poorer ear in case of conductive deafness. Why it gets lateralized to poorer ear? For example, the patient is having the right-sided conductive deafness, left side is normal. So because there is a conductive deafness, that means sound is not transmitting through the air. So there is a masking effect, and cochlear function is normal. So that's the reason the sound gets lateralized to the poorer ear. And what happens in sensory neuronal hearing loss? For example, if the patient is having right-sided sensory neuronal hearing loss, because the cochlear function is gone, then there will be a transmission of sound to the opposite ear, that is the better ear. In same way, these Rinnes and Webers are performed only on the patient, but when you compare your results, that is patient's results are compared with examiner, with a pre-assumption that the examiner is having a normal hearing capacity. So these two tests are absolute bone conduction and square. Both are almost similar, but square is mainly used. It's just a modification to the ABC. And what do we do in these two tests, that is absolute bone conduction or square test? We'll be comparing the bone conduction, only bone conduction from the patient to the examiner. If both are hearing the sound for the same time, then it is normal. If the patient is hearing reduced sound, okay, in comparison with the examiner, then it is a sensory neuronal hearing loss. In conductive deafness, we are least bothered because we are not looking at the conductive deafness in this. Okay, then it is the same as examiner only. What happens in square test? In square test also, we are also calculating the length of time of hearing. It will be equal in case of normal ear. It is shortened or reduced in case of sensory neural difference. It is lengthened because here we won't be occluding the ear. We are allowing sounds from the, that is, there is no masking in this case. So that's the reason the sounds can be lengthened in case of conductive deafness. So this is how you interpret the tuning fork test. You need to by heart this. These are very important.